As we are all aware, this Omicron variant has become a global issue, and we are already in the third wave, and for which, till as of yesterday, the department was not able to come out with any clear-cut results. As you all know, because of the lack of facility within the state, we are not able to furnish any results pertaining to Omicron. But as of today, the 1st of February 2022, for the state of Nagaland, of the total samples that we have sent it to Imphal to do the genome sequencing for the Omicron variant. Of the 152 cases that have been sent, 54 came out to be positive under this Omicron variant, and for which this is for the first time in the state of Nagaland that we are furnishing the details to the public for your information. As one can see it very well, the Omicron variant as such, it comes in a big wave, but it fades away early as compared to the Delta variant. As we can all see, in South Africa, it was overwhelming for some time, but it quickly diminishes. So also, it is expected that with this variant coming to our state, even though it is 5 times more transmissible, it is expected that by the end of this month, things should improve to a great extent. This is what we are hopeful for. And pertaining to closures of schools and things like that, we may have to observe it for a little more time, but hopefully very soon some solutions will be brought about for the children to attend their classes. Ever since the reporting of Omicron cases all over the globe, the department, well ahead of time, we have requested the government of India to help the state with the testing genome sequencing facilities for the state of Nagaland, and even we have written to the state government, and it is assured to us that the government of India, under a certain program, they said they will assist us in getting a testing lab for the state. Definitely, we have already put in place the healthcare delivery system, and in fact, even before this reporting, since last year, as soon as this Omicron was reported, we have issued orders and notices to all the districts in the state to prepare ourselves, even up to the sub-center level. That is from the district hospital, community health centers, the primary healthcare centers, and even up to the sub-centers. So it appears that we are well prepared, and the way we have teamed up the activities in all the districts, not only in the medical department, but at the district task force level, this information has been widely circulated. And for that very reason, the treatment For Omicron or Delta variant, the treatment remains the same. But in case of Omicron, as we can see at the national or international level, the severity is much less. In the Delta variant, the infection is involving the middle or lower part of the respiratory tract. Whereas in the Omicron, it is involving only up to the upper respiratory tract. That means the nose, throat, the larynx, and the bronchi of the upper respiratory tract, and for which, in spite of Omicron coming to the state, we are not seeing people getting admitted for oxygen requirement. In fact, for the genome sequencing, we are collecting samples from whatever BSL-3 lab or 2 lab that is existing within the state. That is from the BSL-2 lab at Tuensang, BSL-2 lab at Dimapur, and the BSL lab 3 at Kohima. So the samples are being, whatever has been collected from Tuensang, the districts that are neighboring the Tuensang will produce their samples to the lab at BSL-3 lab at Kohima, and for Dimapur, in whatever place that are feeding to that lab, it is being furnished to the BSL-3 lab at Kohima. And from here only, we are able to send it to the nearest place, that is Imphal, for the genome sequencing. And the details of from which area, which place, from which district, further details, the department will work on it and it will notify further later on. The actual precautions or advice that we can give to the public, nothing new. The SOP which has been in place should be strictly followed. And moreover, certain guidelines being provided depending on the given situation, the changes that take place accordingly, further notifications and advices may come up. But until as of today, the treatment remains the same and the SOP remains the same. And further, if it is required, we will notify as per the high power committee sitting or whatever at the war room decisions that we feed to the government. These further decisions may come about.